Welcome to the tutorial video for the Brainlab Mask system and upper jaw support. The mask system includes the U-frame, 2 headrests, 2 sets of carbon fibre side posts holding the mask system support block used when moulding the mask, the mask system accessories, and the 3-shell thermoplastic mask sets, as well as instructions onto how to mould a mask. The mask system accessories contain different sized spacer bars and clips for optimal adjustment of the individual mask, as well as the carbon fibre posts. These are in 2 different lengths, allowing standard mask fixation shown on the left side and low mask fixation shown on the right side. The low mask fixation set, which is ideal for deep-seated lesions, may be identified by the longer headrest and corresponding side posts where the drilling is at the end of the posts. When evaluating which type of fixation to use, remember to consider that there should be sufficient space between the U-ring and the patient's shoulders to allow fixation to the localizer, target positioner and couch mount adapter. Our demonstration uses the low mask fixation set. Before commencing the moulding of the mask, the vertical posts need to be positioned according to the patient anatomy, ensuring they are level with the patient's ears. In the majority of cases, the posts will remain in the central position at the screw markings C and U. The moulding process may be carried out on any standard table in the simulator, CT or consultation rooms, resting the assembly on the white mask system support block. A water bath is heated to approximately 75 to 80 degrees centigrade. Place one of the 2 identical sheets of thermotransferable material into the water and leave in the water bath until the mask becomes completely translucent and no longer has any white areas. Using the mesh to help lift the mask from the water bath, shake excess water from the mask and then dry lightly on a towel. Now place the sheet over the pins of the carbon fibre side posts with the straight end of the mask at the uppermost end. Lower the patient's head into the mask and gently press the patient's head into the headrest, making sure that the patient is lying comfortably. Take care not to crush the patient's ears against the side posts. As the thermoplastic material hardens, mould it carefully to the contour of the rear of the patient's head and upper neck area. To avoid the patient's hair sticking to the mask during moulding, you can also place a thin sheet of plastic or shrink wrap over the mask material before lowering the patient into the mask system. Now prepare the clips labelled S and the 2mm spacer bars, which are used when moulding the middle layer of the mask. Place the 2mm spacers on the carbon fibre side posts, making sure the cutout for the spacers faces outward. These are required to add flexibility to the mask system, allowing the spacer bars to be exchanged later with wider or thinner bars should the patient have lost weight or experience swelling. The face strip is now placed in the water bath. Wait until the material becomes translucent, remove it from the water bath and dry it on the towel as before. The face strip is applied with the wider piece just above the patient's eyebrows and with the other strip just below the patient's nose, right above the mouth, and secured using the S-clips. use your fingers to mould the strips to the patient's face. Particular attention should be paid to the moulding at the sides of the patient's head to ensure that the material wraps tightly around the patient's facial contour. Next, place the loose pellets in the water bath. Normally, half the amount applied is sufficient to mould the nasal bridge support. When the pellets have become translucent, remove them from the water bath and knead them to a homogeneous ball. Form a triangle or a T-shape and place over the bridge of the patient's nose, overlapping with a larger strip of the face strip sheet. Press it flat, gently moulding it along the nose and onto the strip over the patient's forehead. Mould it down towards the eyes, but come no closer than 3 mm to the eyes themselves. Now place the last remaining sheet in the water bath and prepare the 2 mm clips. The S-clips need to be removed before placing the top part of the mask onto the posts. Apply the final sheet over the patient's face with the straight end again at the uppermost end, and snap it to the vertical posts using the 2 mm clips. Gently mould it to the patient's facial contours and the middle mask. Particular attention should be paid to the areas of the nasal bridge, the nose and the lower strip of the middle mask, as well as close to the vertical posts. Now the mask only needs to harden. It is recommended that the patient should stay in the mask for at least 15 to 20 minutes, as the mask still shrinks while it hardens. Make sure that the patient is aware of the length of time they will be within the mask before commencing the moulding procedure. The mask is well tolerated by all types of patients, in particular because it utilizes a non-invasive, see-through material from which the patient may be quickly released during treatment if necessary. The optional upper jaw support is an additional element to increase the setup accuracy of the mask system in the longitudinal direction. The U-shaped device is mounted onto the mask system and comes with differently sized measurement bars and the supply of silicone sleeves. Prior to mounting the mask, with the patient lying on the headrest, mount the upper jaw support loosely onto the U-ring of the mask system with the measurement bar mounting pointing downwards towards the patient's body. Decide which size measurement bar is most appropriate for the particular patient and place a silicone sleeve over the measurement bar. Ensure that the patient's head is also angled in such a way that the upper palate completely pushes against the silicone sleeve. Make a visual note of the patient's position, as they should lie at a similar angle when moulding the mask system. Remove the upper jaw support and commence the mask moulding procedure. After the mask has been moulded and allowed to dry, before releasing the patient, mount the measurement bar into the upper jaw support. Ask the patient to open their mouth and affix the upper jaw support securely to the U-ring with both side screws and adjust the measurement bar to fit into the patient's mouth. Adjust the measurement bar so that the silicone sleeve pushes firmly against the upper jaw of the patient and tighten this. Note within the patient's folder the type of measurement bar used, plus the index mark referencing the position of the bar. This information is necessary when repositioning the patient before each treatment fraction. Now remove the upper jaw support from the mask and carry out the CT scan, or release the patient carefully from the mask. When reapplying the mask for treatment, mount first the rear shell plus the appropriate spacer bars. Using wider or thinner bars allows the mask to be adjusted should the patient have lost weight or experienced facial swelling. Now mount the upper jaw support with the correct measurement bar at the precise position previously noted in the patient's folder. Position the patient so that their upper jaw pushes up against the silicone sleeve. Now carefully clip on the top layers of the mask using the side clips corresponding to the spacer bars used. Make sure that the patient is comfortable but tightly restrained within the mask. The upper jaw support can now be removed as it is not needed for treatment. The patient is ready to be set up for treatment using the target positioner box.